The Honourable Parliamentary Secretary to the Minister of Science.
Thank you very much, Mr. Speaker, and thank you for this opportunity to talk and debate Bill C-45. And I really want to start by saying I think the opposition is fooling themselves if they believe that young people aren't already using cannabis. They're using cannabis in record numbers. The present system just doesn't work, and we need to do something. And in some cases, we've heard that it's easier to buy cannabis than it is to buy cigarettes and beer. The current system is allowing criminals and organized crime to profit. And some people argue, as the former member did, that cannabis is a gateway to far worse drugs. Well, I'll tell you what a gateway is. A gateway is when our young people are buying cannabis off of a pusher whose only goal is to get this kid hooked on something even far worse. That's the gateway. So I do agree that something needs to be done as far as education, and I believe that we have, in fact, Bill C-45 includes this. And we need to warn young people about the harmful effects of using pot. And I was happy to attend, just in the last hour, an event sponsored by the Canadian Nurses Association, and they are aware that everyone needs to be educated. And they've released a list of how to reduce the harms of non-medical cannabis use, and I thought it was very helpful. And so I thought I'd mention some of the ideas that they have. Barb Shellian, who is the president of the Canadian Nursing Association, says this is a non-judgmental approach because they agree that whether we like it or not, young people are going to consume cannabis. So I thought I'd list some of the concerns that they have because they're concerns for all of us. Number one, they said to reduce the harms of non-medical cannabis use, delay use until early adulthood. Since the risk of dependence is higher when use begins at an earlier age, cannabis use disorder and its related health harms may be reduced or avoided if use is delayed until early adulthood. I agree. We agree. This is the education that must get out to our young people. 2, minimize frequency of use. Because the risk of harm increases with the rate of use, avoid frequent, daily, or near daily use. Good advice. 3, try to stop when use becomes hard to control. Frequent users of non-medical cannabis who experience difficulty controlling their use should attempt to stop with professional help as necessary. 4, minimize respiratory complications. To reduce respiratory complications, avoid smoking cannabis with tobacco, refrain from deep inhalation and breath holding, and consider using a vaporizer rather than smoking. Number 5, avoid using amounts that are large or highly concentrated. Be wary of excessive use or high-potency THC cannabis, including synthetic cannabinoid products. Consider adjusting the dose by using only an amount needed to achieve the desired effect. Now, while some people may think this is encouraging the use of cannabis, this is education that our young people need, and I'm so glad that the Canadian Nurses Association has put this together. There are a number of further ideas that I think we should all hear about. They talk about refrain from using non-medical cannabis with alcohol. Mixing non-medical cannabis with alcohol can increase impairment and can also cause anxiety, nausea, vomiting, or fainting. Avoid driving while high, of course. Given that the effect of cannabis consumed by inhalation typically peaks after 30 minutes and gradually subsides after 1 to 3.5 hours, avoid driving for at least 6 hours after use by inhalation. Wait longer if high-potency products or larger doses were used, if acute impairment persists, or if the cannabis was used with other substances, including alcohol. This is information that we need, and this is information that our young people need. We know that young people are consuming cannabis, but are they getting this information? And I'm so glad that the Canadian Nurses Association has put this out. Share with care. Here's an interesting one. Users should take care to minimize lip contact with joints or implements for smoking or vaporization. Shared items that come in contact with the lips increase the risk of transmitting infections, including meningitis, influenza, and other pathogens. Vulnerable groups should abstain from use. An increased risk for cannabis-related problems can occur in high-risk groups, including pregnant women and individuals with a personal or family history of psychosis. These groups should avoid use altogether. I couldn't agree more, and this is information our young people need. Use caution when ingesting cannabis. To avoid accidental overdose with cannabis edibles, start low and go slow. States where cannabis is legal recommend starting with no more than 10 milligrams of THC and waiting at least 2 hours before ingesting more. So this is really good information that comes out from the Canadian Nurses Association. I'm sure it's on their website if you want to check it out. And I'm so happy that our government is investing in public education and law enforcement, because we all not only need to regulate, but we need to educate. So our government is investing up to $274 million to support law enforcement and border efforts to detect and deter drug-impaired driving and enforce the proposed cannabis legislation and regulation. We've committed up to $161 million for training frontline officers and how to recognize the signs and symptoms of drug-impaired driving, building law enforcement capacity across the country, providing access to drug screening devices, developing policy, bolstering research, and raising public awareness about the dangers of drug-induced driving. Provinces and territories will be able to access up to $81 million over the next 5 years for new law enforcement training. This is so important. We know that we need to do this hand in hand with legalizing cannabis. Our government has also committed $46 million over 5 years for public education, awareness, and surveillance. And these additional resources will also allow the government to undertake a robust public awareness campaign so that Canadians, especially young Canadians, Canadians under the age of 25, are well informed about the dangers of driving under the influence of cannabis and other drugs. Our government will invest additional resources as needed to make sure there is appropriate capacity with Health Canada, the Royal Canadian Mounted Police, the Canada Border Services Agency, and the Department of Public Safety and Emergency Preparedness to license, inspect, and enforce all aspects of this proposed legislation. In the months ahead, our government will share more details of a new licensing fee and excise tax system. It will also continue to engage with all levels of government and Indigenous people, because we know that not only the federal government, but the province and municipalities are very interested in how we're going to roll this out and how the tax system will impact the coffers of all of the governments. I do want to go back to what I was talking about before, about how we can't keep our heads in the sand. We have to be realistic that the number of young people smoking pot, consuming cannabis is very high in Canada. It's one of the highest in the world. And this is something that has concerned every parent of a teenager. And my children are adults now. I'm a grandmother. And I worry about the harmful effects of cannabis on my young grandchildren when they get to be teenagers. But I know that by then we will have the education that they need in order to make sure that they're making wise decisions, decisions that are made by young children every day in this country. And for the most part right now, many young people are making those decisions without thinking twice, without even considering the harm that it will give them if they decide to start to smoke cannabis. Thank you, Mr. Speaker, and I look forward to any questions.
Questions and comments. Questions et commentaires. The honourable member for Sarnia-Lambton.
Well, thank you, Mr. Speaker, and I'd like to thank the member opposite for her speech. And she's quite right that with all the children that are now smoking marijuana, we need to get them off it, and it's public education and restricting access that will do that. And I was also at the Canadian Nurses Association, and so pleased that they brought out that public awareness and education campaign. And you know why they brought that out, Mr. Speaker, was because there's a total gap in that area. Because although this government has been committed to this promise for 2 years, they've done absolutely nothing. I've seen the RFP that went out looking for a contractor to put together the program to roll out the public education and awareness. And that RFP was awarded at the end of October, Mr. Speaker. So there is no education program. I've certainly been looking for it. So my question for the member is, why did the government, if they knew they were going to legalize it, not start on their public education and awareness 2 years ago?
The honourable parliamentary secretary.
Thank you, Mr. Speaker, and thank you to my honourable colleague. The point is well taken. We do need to educate, and today, and this is when we're doing it. And we need to make sure that our young people get the information. As many young people receive information is a lot different from how we used to receive information. And so we are going to start now in this House as we debate this. We're going to talk about it. We thank the Canadian Nurses Association for getting involved in this education campaign, and we agree that we need to do even more, and that's why our government is committed to spending millions of dollars to educate people across Canada. Thank you.
Questions and comments. Questions commentaires. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Mr. Speaker. And I want to pick up on my colleagues, one of the points, and that is, you know, in representing Winnipeg North, as it is in many communities across our country, we do have a lot of young people that are especially vulnerable. They're vulnerable from individuals that participate, whether it's in gangs or the criminal element, where there is that financial incentive for them to go to our schools and to our playgrounds, where they're actually encouraging, promoting cannabis and marijuana in return for finances, and the single objective for them is to bring money into an organization or to put money in their pockets. They're not thinking of the health and the well-being or the long-term impact it's having on our young people. And now, for the first time, what we're seeing is a government legislation that will at least go a long way, I would suggest, in dealing with that particular issue. And if she can just provide her thoughts on my comments.
The Honourable Member for the Honourable Parliamentary Secretary to the Minister of Science.
Thank you, Mr. Speaker, and thank you to my honourable colleague for raising that issue, talking about the gateway drug. And, you know, I remember I used to work for a school board prior to getting into politics, and we would talk quite often about drugs in schools and how to combat it, and it was very difficult. You know, I was concerned with what schools my children were going to. I was hoping to be able to make sure that they were in a school that there were no drugs. And I spoke to both a trustee and one of the superintendents at that school. And this is when my children were young, and it was kind of disheartening to hear them say that there are drugs in all schools. And if you think that you can make sure that young people aren't faced with this, you're really mistaken. And that was years ago. And so this has not gone away. And our young people are unfortunately, getting the drugs from people who have nothing but their own interests in mind, and they want to make money, and they're making money illegally. And this is the best thing for us to do, is to legalize cannabis and to make sure that we are undergoing a strategic education to make sure that our young people know the risks involved.
Reprise de débat.